Ladies, wait a minute. Did you hear that PCOS has a new name? Because when I first saw this, I literally stopped and thought, wait, what happened to PCOS? Apparently, the condition many of us have known for years as PCOS is now being referred to with new terminology, PMOS. And if you're sitting there thinking, PMOS, what is that? Please do not worry, you are not the only one. Let's talk about it. And stay with me because I'm going to make this whole thing very simple. No big medical lecture, no confusing terminology, just what's changed, why it changed, and what it actually means. So first, PCOS stands for Polycystic Ovary Syndrome. The new terminology is Polyendocrine Metabolic Ovarian Syndrome, and that's shortened to PMOS. Now, before somebody hears this and starts panicking, no, this does not mean that women who have been diagnosed with PCOS suddenly have a completely different condition. It doesn't mean that. The terminology is changing. PMOS is the new terminology introduced for the condition previously known as PCOS. So why change the name at all? That's the interesting part. The international process involved healthcare professionals, patient organizations, and women with lived experience. And one of the reasons behind the change was that the old name could make people think that the condition was mainly about having cysts on the ovary. But that doesn't give the full picture. The ovarian findings associated with the condition can be small follicles, and these aren't the same thing as ovarian cysts. No, they're not. Many people imagine when they hear the word cyst. So the new terminology is trying to shift the conversation away from it's just about the ovaries and toward this condition has endocrine, metabolic, and ovarian aspects. And honestly, I think that's the part we need to understand. Not just memorizing another complicated medical name. But understanding why the terminology is changing. Yes, understanding why the terminology is changing. Now let's break the new name down. Polyendocrine, that's pointing towards the endocrine or hormonal side. Metabolic, that points toward metabolic aspects. And ovarian keeps the reproductive and ovarian part represented in the name. So put it together, Polyendocrine Metabolic Ovarian Syndrome, PMOS. Now I know some of you are probably asking, if I've had PCOS for years, does it mean my diagnosis was wrong? No, not at all. PCOS is the name that has been widely used for decades. PMOS is the new terminology introduced through the 2026 international renaming process. So if you have been saying PCOS all these years, you haven't been saying it wrong. And you are likely to continue seeing PCOS and PMOS used for some time while the new terminology becomes more widely accepted or rather adopted. Now let's talk about something that has confused women for years, the word polycystic. Because when people hear polycystic, they immediately think, oh, cysts. And then someone may look at an ultrasound and say, I don't have cysts, so I can't have PCOS. Please, do not diagnose yourself that way. A diagnosis isn't something you should make from one ultrasound or one symptom, or a checklist you found on social media. Healthcare professionals consider the overall clinical picture when assessing someone. So please don't watch this video and start counting symptoms and start saying, oh, I have this one, I have that one, therefore I have PMOS. No, that's not how you should diagnose yourself. Or rather, that's not how you diagnose yourself. A woman can experience this condition differently. Oh yes. A woman may talk about irregular menstrual cycles. Another may experience acne or changes in hair growth. Another may have fertility concerns. and another may have metabolic concerns. The point is, women don't all experience the conditions in exactly the same way. So if something about your health concerns you, please get proper medical advice rather than trying to diagnose yourself from a YouTube video. Now, why should we even care about a name? Because name matters. Yes, names matter. The name of a condition can influence how people understand it, right? And according to the organizations involved in this international process, the goal is to use terminology that better represents the broader endocrine, metabolic, and ovarian aspects of the condition. So this isn't about saying PCOS was a fake name. No, it was the established name. It has been used by patients, yes, healthcare professionals, researchers, and the public for many years. This is about introducing terminology that the international process believes gives a broader description of the condition. And honestly, here's the easiest way to remember it. PCOS is the name you've known. PMOS is the new terminology being introduced. Same condition, new terminology. And please, don't let a name change video on the internet make you panic. Don't stop your medication because you had a new name. Don't start taking supplements because somebody in the comments says, take this and balance your hormones. And please, do not diagnose yourself from social media. This video is simply explaining a terminology change. Your own health situation is personal. And that's where a qualified healthcare professional comes in. So let's make this really simple. PCOS stands for Polycystic Ovary Syndrome, while PMOS stands for Polyendocrine Metabolic Ovarian Syndrome. An international consensus process in 2026 introduced PMOS as a new terminology for the condition previously known as PCOS. The purpose is to move away from the name that makes people focus mainly on polycystic ovaries and toward terminology that reflects the broader nature of the condition. That's it. Please, you do not need to panic. You don't need to relearn your entire medical history, and you certainly don't need to change your treatment just because the terminology changed. Now I'm curious, have you heard of PMOS before today? Or is this literally the first time you are hearing that PCOS has a new name? Tell me in the comments. So if you enjoy simple, evidence-informed health information explained in a simple way that actually makes sense, please subscribe and join us. And if you know a woman who has always known this condition as PCOS, share this video with her, because chances are she's probably going to see the word PMOS somewhere and think, wait, what is that? Now you know. Thank you so much for watching. I will see you in the next one. And your public health instructor.